On April 21, 2020, in the live broadcast of CCIF 2020 online, Professor Li Jianping of Peking University First Hospital completed a difficult operation successfully. It is worth mentioning that when choosing treatment strategies for patients Professor Li Jianping, they were assisted by functional assessment (caFFR) and imaging (OCT). And the intervention plan was finally determined based on the functional data provided by caFFR. The patient was a 52-year-old man. Coronary angiography showed that his blood vessels were severely diffused and tortuous. Among them, the left anterior descending artery, ABBR. LAD was 95% narrowed. The first diagonal of LAD, ABBR, D1, was 95% narrowed, and the circumflex artery, ABBR, LCX, was 99% narrowed, because the circumflex branch, LCX, has sufficient collateral circulation. It is unnecessary to intervene temporarily. In order to further determine the treatment strategy, Professor Li Jianping conducted a functional evaluation using caFFR, which can avoid using pressure guide wires and vasodilator. The FFR value of LAD was 0.74, and the FFR value of D1 was 0.63. Because the FFR values of both arteries are less than 0.75, so this patient was suitable for revascularization therapy. After integrating the patient's imaging and functional data, Professor Li Jianping's team determined to intervene the stenosis of LAD and D1. Professor Li Jianping implanted a 3.0 mm*, 34 mm and 4.0 mm*, 26 mm stent respectively at the distal and proximal ends of the patient's LAD, and 3.0 mm*, 33 mm stent was implanted in the D1. At the same time, a 3.0 mm dilated balloon was used in the main branch. After implantation of the stents, the postoperative caFFR evaluation showed that the FFR value of D1 was 0.95, the FFR value of LAD was 0.91, and FFR value of entire LAD was 0.89. All the values showed that the operation was a complete success. The experts who watched the online live broadcast of the surgery remotely and the team of Professor Li Jianping discussed the combination of imaging evaluation and functional evaluation to assist in the development of surgical strategies. Experts at the meeting stated that functional evaluation (caFFR) and image evaluation (OCT) should be performed simultaneously if it's conditioned. When only one evaluation method can be used, it was recommended to give priority to functional evaluation, because functional evaluation (caFFR) can assess the patient's blood supply was sufficient or not. Especially caFFR could measure the FFR value of multiple sites at once, which was important and significant in clinical value. At present, the application of FFR is more and more extensive. Professor Peng from Second Affiliated Hospital of Dalian Medical University in Liaoning Province pointed out that in this case, if we use pressure guide wire to get the FFR value, in this case the stenosis would be overrated, because it's a long lesion and the stenosis is tortuous and diffuse. So when we use the guide wire, there would be inevitable vasoconstriction happening during the examination. Thanks to the advanced technology from caFFR, we can get accurate result without using any interventional accessories. According to the performance during the operation and the previous clinical trial, the experts at the meeting spoke highly of caFFR. Becqua say it could save time for doctor, reduce risk during the operation, cut off the cost of patients, etc. There are advantages which they couldn't experience during conventional PCI operation. As more and more PCI operation conducted nowadays, functional evaluation can help doctors determine quick and accurate operation strategies. And caFFR provides more opportunities to promote FFR examination in clinical application. Thank you for your interest in RainMed.